If your baby is OP, which means the back of their head is towards the back of your pelvis, also known as posterior or sunny side up, and you're panicking and you're pregnant or you're in labor, watch this video because we're going to break down some exercises that you can do to help your baby rotate to get into a more optimal position. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and the author of Training for Two. Training for Two is all about how you can use your prenatal fitness to help stay strong throughout your pregnancy, pain-free, and also to help you prepare for birth. And there's exercises and labor positions within the book to help create more space within your pelvis so that you can have an easier labor. If you want to check out Training for Two, check it down in the notes below. If your baby is OP, this means the back of their head is towards the back of your pelvis. And for a lot of us, this can cause a lot of anxiety because it could make it a little bit harder for your baby to pass through and to navigate the pelvis. When babies are OP, their back of their head is hitting into the back of the pelvis and it pushes them forward slightly. And so then they're going to overlap that pubic bone and it can make it harder for them to pass through or enter into the pelvis. Some of these babies end up being born via C-section and they'll actually have this line across their forehead from where they were pressing into the pubic bone. OP positioning can sometimes also cause back labor or make your contractions more painful, and so it's understandable that this can cause a lot of anxiety for folks during their pregnancy and during their labors. If your baby is OP during pregnancy, we don't necessarily need to force them into a specific position because babies are going to continue to kind of move and wiggle around throughout their pregnancy until there are strong contractions to keep them in that position. So don't focus on trying to force your baby into what you think is the best position for them during pregnancy. Rather, we want to ensure that baby's path to rotate is clear. And what I mean by that is when your baby begins their rotation during labor, we want to ensure that their path or all of the physical structures in their way is clear of obstructions and restrictions that could impede their ability to rotate. So first, we can start with the uterus. How balanced is the uterus and all the ligaments that attach to it? We can do different exercises to help release tension in the vertical running ligaments to help create more space within the pelvis and make it easier for your baby to rotate. We can then take a look at the pelvis and the muscles that attach to the pelvis and how balanced they are to each other on each side. So taking a look at the pelvic floor, the glutes, and the hip flexors, and how easy it is for us to change positions to create more space within the pelvis to help your baby enter into the pelvis. To help release tension in the vertical running ligaments, we can do a forward-leaning inversion or any sort of movement where your shoulders are below your hips. In the forward-leaning inversion, you're going to come down to the floor all the way down to your forearms, and we want to be in a fairly stacked position. And then we want the legs to be fairly relaxed on our elevated surface as well. So we don't want the feet to be up, which can create a lot of tension within the glutes. In this position, you should feel a little bit of a release in the lower back and a release within the belly. And we're going to breathe here for 3 full breaths. You'll take a big inhale in and then exhale to release. And in this movement, we're focusing on the round ligaments and the uteral sacral ligaments that are at the bottom of the uterus and in the front of the uterus to help it make it easier for a baby to rotate within the uterine structure. The next move that we can do to help address the round ligaments and the hip flexor musculature is going to be the 90-90 side camel. So in this 90-90 position, we have one leg externally rotated in front and the other internally rotated behind you. We'll start with this side body opener to reach towards the internally rotated leg. So you're going to feel a big stretch here in the side body and in this hip and groin area. After that, you're going to reach that hand down behind you to extend in the hip. We're going to feel a big stretch in this hip flexor right here because the hip flexors can influence how well we can create space in the top of the pelvis to help our babies engage. And so you can do this 10 reps on each side. So we find that side body opener, and then we reach behind to extend in the hip to stretch in that hip flexor. The next exercise that we can do is going to be a hip shifted exercise, and this is in an all fours position. We have one knee on a yoga block, and then she's shifting her weight over to that elevated hip, and so we're going to have about 80 to 90% of our weight in that elevated hip. What's happening here is her pelvis is rotating towards the femur, so we're coming into a closed hip position, which means that the angle between the femur and the pelvis is decreased. An open hip position would be that the pelvis is moving away from the femur. So we're in this closed hip position, which is then creating more space in the posterior pelvic floor in between the tailbone and the side of the pelvis here. And so it's stretching this pelvic floor in the back half of the pelvis to improve how well the sacrum can move. Now in this position, she can then move through some pelvic tilts to increase mobility of the pelvis from the front to the back. So dropping the belly to the floor and then arching in the back. And this is going to help to, again, improve pelvic to hip mobility, release tension within the pelvic floor, improve how well that sacrum can move to create more space in the top of the pelvis to allow baby to enter and to rotate. So during pregnancy, what we are focusing on is ensuring that baby's path to rotate is clear. And this involves releasing tension in the uterine ligaments with those inversions and the 99 side camels, and then also ensuring that the muscles that support the pelvis are fairly balanced, and we can do that with that 99 side camel and the all fours hip shifts. Now, when it comes to labor, if you are in labor and baby is having a hard time entering into the pelvis because they are OP or posterior, or you're having a lot of back labor and you don't normally have a lot of back labor with your menstrual cycle, it could be because baby is OP. And so we want to do things to help baby begin to rotate so they can then enter into the pelvis. The first thing that we can do is to find an inversion, which is going to bring baby to a level where they have a little bit more space so they can ideally begin to rotate to wherever position they need to move into. After that, we're going to move to an upper mid-pelvis opener, which is a one-sided open hip position to create more space in the upper mid-pelvis to help baby begin their rotation into the pelvis. So if they're OP, we're going to create space in the upper mid-pelvis so they can rotate and then enter into the pelvis. And then following that, we're going to move into a position that helps to create more space in the inlet or an upright open mid-pelvis opener to help baby then engage into the pelvis. If you're in labor and your contractions are closer together, so less than 5 minutes, we can find that forward leaning inversion in labor. You can also do a puppy pose. So you'll hold this for the duration of the contraction to help your baby move to a level where there's a little bit more space. And then your partner can put a scarf, a bedsheet, or a rebozo over your butt to help kind of jiggle, to help relax the pelvic floor, and maybe help baby kind of wiggle. So they'll just kind of jiggle from side to side to help relax the pelvic floor and allow baby to rotate by kind of wiggling them into that space. If you find that the forward leaning inversion is too intense or your contractions are spaced out more than 5 minutes apart, we can also do a less intense variation with the puppy pose. So in this, your hips are elevated and your chest is down on the floor or your supportive structure. And same thing here, your partner can do that same shaking motion to help relax the pelvic floor and to help baby kind of wiggle into a better position. If you're in labor and you're at your hospital, you could also use the labor bed to get into different inversions as well. So you can use the labor bed to get into a forward-leaning inversion where you have your forearms on the lower part of the bed and your knees on the middle part of the bed. And then you can also do a puppy pose in the bed as well. If you have an epidural, your inversion can be Trendelenburg the bed, where they tilt the head of the bed down to bring you into an inverted position to help your baby rotate. After we've done the inversion, we then want to release tension in the hip flexors so that we can find a more tucked position to help baby enter into the pelvis. When we can tuck the butt underneath, it moves the sacral promontory, or the junction between the sacrum and the lumbar spine, backwards, creating more space front to back in the top of the pelvis. However, a lot of us tend to have really tight hip flexors, which is going to pull our pelvis more forward, which can make it harder for baby to enter into it. So releasing the hip flexors is a great way to be able to find that tucked position. First, we're going to do a half kneeling hip flexor stretch where you're going to tuck the butt underneath, push those hips forward to feel a big stretch in the front side of the thigh, and then that same side arm can reach overhead and across. And then your partner can stand next to you to pull to bring some more length to that side so you feel a big release in the side body and that hip flexor. They can either stand next to you. They can also kneel next to you so that you can put your forearm on their leg, and then they can pull to find that side body release. Now, if we have an epidural and you need to be in a more supported position, we can also do a sideline partner supported hip flexor release. So they're going to put their hand on your hip and then grab underneath your knee, bring the knees a little bit closer together, and then they're going to bring that knee back as they push the hip forward, and you should feel a big stretch in that hip flexor. If you don't, they may have the knee a little bit too high, so lower the knee and then push the hip forward, and you'll probably feel that stretch there. Next, we can focus on our upper mid-pelvis opener to create more space in this portion of the pelvis to help baby begin to rotate. So you'll place your left shin onto a peanut ball, and this is going to bring your hips into that open hip position, which is going to help to create more space in that upper mid-pelvis. From here, you'll just kind of rock your leg back and forth, and you'll stay here for 3 to 4 contractions or 20 to 30 minutes until you either feel a shift or the time has run out, and then you'll move to the other side. Now, if you're having a hard time getting into a tabletop position with the peanut ball because you have an epidural, then this exaggerated sideline can be a great variation to do. So you'll place that leg onto the peanut ball, and then we're going to find that same open hip position. So I'm driving the knee forward, bringing the belly more towards the floor. And so in this position, you'll feel a little bit more of a groin stretch because that leg is coming out to the side. And same thing, we'll stay here for 20 to 30 minutes until you feel a shift, and then you'll go to the other side. After being on the side lying upper mid-pelvis openers to help baby begin to rotate, we can continue with upper mid-pelvis openers to help baby then engage into the pelvis by creating more space in one half of the upper part of the pelvis. And we can do this upright with an elevated lunge with an open hip position. You can also lean into your partner, and then as you lunge into the leg, your partner can gently press into your knee to help create a little bit more space as well. If you want a more supported position, you can also do a half lunge position with the birth ball, so you can rock back and forth into the ball as you find that open hip position. If your baby is OP during pregnancy, try not to panic. We don't need to force baby into any specific position, but we do want to focus on ensuring that their path to rotate is clear. So this involves releasing the uterine ligament, ensuring that the pelvis is balanced and the muscles that attach to the pelvis are balanced so that it's easier for your baby to rotate when labor does begin. If you're in labor and baby is OP, this can sometimes make labor a little bit slower or potentially even more painful. So there may be a little bit more urgency in trying to help baby get into a better position. We can do things like inversions with the booty shake to help baby begin to rotate. We can then create more space in the upper mid-pelvis with those open hip positions to allow baby to begin their rotation, and then coming into upright positions to help baby then engage into the pelvis. If you want more information like this on how you can create more space within your pelvis, exercises that you can do during pregnancy to help prepare for birth, check out our online prenatal fitness programs. Our online prenatal fitness programs give you daily workouts to not only keep you strong and pain-free throughout pregnancy, but also to help you prepare for birth, and not only for birth, but also for postpartum recovery and your journey into motherhood. Our prenatal fitness programs are offered in two main formats. We have our app-based format and our on-demand-based format. Our app-based format is going to be self-paced workouts that are 15 to 20 minutes long or 45 minutes long, depending on the length of the workout that you want to do. And this is going to be a list of exercises with short demo videos. The app-based program also includes birth prep workouts as well. So if you're looking specifically for those exercises to help release tension in your pelvic floor and to create space, the app-based program has that. If you prefer to follow a video as you work out at the same time, our prenatal on-demand program is going to be the program for you. And we also include full-length workout videos to help you prepare for birth as well. If you want to learn all about laboring positions and how to address labor stalls and kind of the mechanics of how to create space within your pelvis, check out our online childbirth education course. We discuss pelvic mechanics, labor positions, labor comfort measures, birth options, and tons of other information to help empower you on your birth journey. You can check out all of our course offerings on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. And you can bundle things together to save an additional 15% off for a total of 25% off in savings. If you like this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release new educational videos throughout the week, new workouts on Tuesdays, and podcast episodes on Wednesdays.